Time? All right. It's 6 o'clock, so we'll go ahead and call the meeting to order. And we'll turn the meeting over to County Administrator Wayne Adams for the election of the chairperson for 2021.
Yes, the floor is now open for nominations for the position of chair of this committee.
I nominate Todd Johnson.
Second.
No other nominations. Can we take that in the form of a motion?
I take a motion.
And Mr. Scurry seconds, and then all in favor? It's unanimous, Mr. Chairman.
All right. Thank you, sir. We'll turn to our agenda. Are there any additions, deletions, or that need to be made to the agenda tonight? No. Hearing none, do we have a motion for the adoption of the agenda?
I so move.
Motion and a second. Any discussion? All in favor by show of hands. Opposed likewise. That is carried. Now we have the approval of the October 5th, 2020 minutes. Is there a motion to accept those minutes as they were published? Motion and a second. Any discussion? All in favor by show of hands. Opposed likewise. All right, we'll move into the public appearances from Mr. Tommy Long, who's our Emergency Services Coordinator. And the first item we have is a DHEC COVID update.
Okay, thank you, Mr. Chairman. I wanted to kind of introduce our speakers tonight. I've asked the departments to kind of present with y'all tonight what they accomplished last year and kind of some of their goals for this year. So, as you all know, we've been tied up extremely heavy with the COVID situation that we're in. So to sum up my position, that's what I've been working on for the past year, mostly every day of the week. But I wanted to invite them here tonight to kind of give y'all an update on their departments and kind of what's going on there. I'd like to thank DHEC for being here, Ms. Bannister and Ms. Lindler. They're going to give us an update on the DHEC side as far as what we've been dealing with, and I'm sure all of y'all are aware of everything that's going on, but they're our experts in the county. They're great to work with, and we have a really good working relationship with everybody you see on this agenda tonight, and that means a lot to me in my position. It makes my life a lot easier. So I want to go ahead and let them start with our first presentation.
Okay.
If they come up.
Good evening, I'm Kelly Bannister and this is Cindy Lindler. We're going to talk a little bit about COVID. Some of the goals from our response overview. The efficient and equitable distribution of COVID vaccines, continuing to provide testing to anyone who wants it across the state, maximizing case investigations and contact monitoring, while also providing guidance on mitigation, providing timely, accurate data and information to the public and leaders so that they can take appropriate action to help prevent the spread, supporting our most vulnerable communities, including nursing homes and assisted living facilities, and improving operational efficiencies. COVID by the numbers. Statewide, we've received over 4 million test results. We've administered 166,437 doses of COVID vaccine. We have over 300 testing events open throughout the state, and we have conducted more than 20,000 virtual inspections of retail food establishments to maintain food safety standards. We've completed in-person infection control inspections of all 194 nursing homes in the state, provided 179 point-of-care antigen testing devices to those nursing homes. We've trained 377 EMS and 30 National Guard medical personnel to give testing. To support this work, 2,600 plus DHEC staff have worked over 1.2 million hours so far for this response. Some information regarding Newberry County, and this data is as of Friday, the 22nd at 11:59 p.m. The rate of COVID infections or positives is 762.2 per 100,000. We've had a cumulative total of 3,629 positives for Newberry County. And the percent positive on the 22nd was 17.5%. Also, total cumulative cases, there's been 3,178 confirmed and 451 probable cases, 71 confirmed deaths and 8 probable deaths, and hospitalizations 125. And just the breakdown on the age there, 1.7% are 0 to 20 years of age, and 98.3% are 21 to 81 plus years of age. And Cindy's going to talk a little bit about the vaccine.
Hey, thank y'all. The vaccine phases and the populations, as you know, right now we're still in phase 1A. There's an estimated 987,039 people in this phase 1A, and they consist of the long-term care facility residents and staff, the healthcare personnel, admitted patients to the hospital whom are age 65 and over, and also for anyone 70 years of age and over. The phase 1B, which is an estimated population of 573,501, are going to be the frontline essential workers. And just keep in mind that some of these numbers do overlap, so they're not exactly, because there could be people in phase 1A that should be in 1B, but they just fall that way because that happens to be their age range. Phase 1C is an estimated 2,897,527, and these are all people age 65 to 69, people age 16 to 64 with certain underlying health conditions, and other essential workers. And then we jump to phase 2, which is the estimated 690,648 people. Basically, that's the people that's left. All the people who wish to be vaccinated and the ages per recommendations by the ACIP. And these also may overlap. Is there a slide missing? No, it's just missing. So we're expanding with who can vaccinate. There's a joint order with the LLR that is trying to get us more people that can vaccinate because, to be honest with you, there's just not enough vaccinators to go around. So we're opening it up to unlicensed personnel with current certification by certain board certifying boards. So that's like medical assistants, and then students of any accredited medical school with the appropriate instruction and documented training. Any registered nurse, licensed practical nurses, physicians, and physician assistants who may have previously been retired or became inactive, as long as their license is still good and it hasn't been lapsed for over 5 years. And dentists who may administer vaccines at dedicated sites. The state's vaccine pipeline is growing, but the supply is not currently sufficient to meet the growing demand. The Pfizer vaccine average, usually the state gets in about 32,700 doses per week. That's usually what we've gotten in over the last 4 weeks. The Moderna vaccine averages about 30,200 per week in the last 4 weeks. And we don't really see any change in the foreseeable future on that. Remember, it takes 2. 1 dose of vaccine helps your immune system to begin building the protection that you need to prevent the disease, but the 2nd dose is also needed to complete the protection process to save lives and prevent illnesses. And to the right, you can see an appointment checklist of things that we recommend. We recommend that when you go in for your 1st dose, you go ahead and set up your appointment for your 2nd dose. And basically, that's what that's saying, is not to leave your 1st dose appointment without knowing how and when to get your 2nd dose, because you only have a certain amount of time. It has to be at least a certain amount of time between doses. This is on the web. You can go to southcarolinadhec.gov/vaxlocator and to see all the locations that are accepting appointments, or you can call the care line to find out more information. We do not make the appointments on the care line. They actually just give you information as to which ones are available, so if you don't have internet access. And All the green ones you see are the ones that are ready to start accepting vaccine appointments. And the red ones, they're in process, but they're not ready yet. So as soon as they're ready to start, it'll turn green. And also you want to keep in mind that just because you get vaccinated, you still do need to wear your mask, social distance, stay home if you're sick, wash your hands, stay away from large gatherings. And when it is your turn to get vaccinated, you get vaccinated. So until everybody is cycled through, we still have to keep doing what we're doing. And that's it.
Okay. Any questions from this committee?
I have a question. The biggest concern I have heard with the elderly is when they try to sign up, you have to have an email. They don't
Yes.
have emails.
That was actually something that the federal government put in place. And we definitely know it's a roadblock, and we're working to try to change it, but
They're coming
That's-
up with a new
yeah.
appointment system, it's being tested.
There's only
This week.
one, you can only,
right,
There's
you
the
have to
one
have one
per
email per person. You
Right.
can't share the emails.
But
But
DHEC's working on
Yeah.
its own system instead of the federal system.
we're trying.
So
It's
they're
just
still troubleshooting that.
because we didn't even realize that ourselves.
yeah, I had one individual that called me and said that she got her online with hers, but her husband don't even get on a computer.
Right,
They finally found a place to put in your phone number, but they've not heard anything.
Right.
so.
well, we didn't even, we weren't even aware of that. Actually, somebody told me that because I wasn't aware that you had to have, individual emails for individual people. So, but that's a work in progress we're trying to work on.
Any other questions? Well, we've used the term unprecedented times until it's almost precedented anymore.
Yes.
But thank you for your dedication and hard work and what's being done in the community. I know that some of the frustration with the number of shots is coming at you, but the truth is you're just the messenger. And so
Yes, sir, that's true.
we appreciate the efforts
Well,
that
thank
you all have made, and we certainly stand supporting you.
Thank you, we
Thank you.
appreciate it.
Thank you for the information.
Next is our fine elected coroner, Laura Neese. And we understand you've been under the weather a little bit, so
Yes, sir. I had double disc replacement surgery in my neck about 2 weeks ago, so
bless your heart.
I got an extra little impingement going on here tonight. So
Well, if you need to sit while you present, that is certainly okay with us.
I'm a tough girl. Thank you.
Okay?
So, what I did with my PowerPoint is, since I know Ms. Arrowood is new to council, and I know that did a little bit of a review of what the coroner's office actually does in the county, as well as to report my statistics for this year. So, which button is it? All right, I'm going to start off with the mission statement for the coroner's office. It's to serve the citizens of Newberry County with professionalism, integrity, while upholding the commitment to determine the cause and manner of death in a dignified manner and maintain the respects of the families. So we did a lot this year, even with the pandemic. What the coroner's office does is the information that we collect during the investigation helps clarify the circumstances, such as the sequence of events prior to one's death, evidence collection during the investigation, and/or the postmortem examination, which will help lead to the arrest and the successful conviction of a suspect in a homicide case if we see fit, along with law enforcement. Because the deaths occur around the clock, the coroner's office is staffed 24 hours a day, 365 days a week. With the skills and experience of the coroners, investigators, and board forensic pathologists who we have housed here in Newberry County, that's a very lucky caveat that we have. We believe that the death investigations in Newberry County has become about the best in the state. The death scene investigation reports that we file by the investigators are very thorough and supply comprehensive information to the forensic pathologist, law enforcement, DSS, SLED, LLR, and various other entities. Our investigators also extend their duties to the living by answering questions and addressing concerns regarding deaths within the county. Coroner investigators are in personal contact with family members of the deceased and assist them providing appropriate answers regarding the circumstances of the deaths. Coroner's investigators are supplied, we supply each family member that we can get in contact with a pamphlet that gives them information and answers to common questions and facts about autopsies and other services that we can help provide for them, especially pertaining to grief counseling. In 2020, our office contributed significantly to the input towards the implementation of a web-based death investigating reporting system. After aiding the Occupational Research Assessment Incorporated that's located in Michigan, they developed, we added them into our office and launched what's called the Meta-Legal Death Investigation Log, or MDI log. It's a comprehensive investigative reporting system and data system that is actually tied into NMS, which is one of the major toxicology companies that we use. It is tied into NAMUS, which is for the unidentified personnel. It also can be tied into with our forensic pathologist, so they can just go onto the system and get all the information they need for upcoming autopsies that are planned here in Newberry County. It enables us to submit comprehensive death investigation reports via the internet, and it's become a very valuable tool for us. There's several other counties in the state that are using MDI log, and we're able to communicate with those counties if they see a cross-reference of a similar name of a decedent. Any entity that has it in South Carolina or across the United States, it flags us and says, hey, this guy's name or this lady's name, gender, and date of birth is a person of interest in, say, Austin, Texas. And we're able to contact them and reach out to them to see if it's the same person or not. So with that being said, we do want to extend our sincere gratitude to you, the County Council, for your support of the Coroner's Office System and for the citizens of Newberry. So, some of the duties that we have, we investigate sudden, violent, and unexpected deaths. We're charged with making positive identifications of decedents, either through interviews, investigations, or forensic science. We determine the cause and manner of one's death. We make family notifications. We also certify the investigations in the during the post-mortem examination as required by law. And we report and distribute the findings, as I stated earlier. And we also issue cremation permits. No one in Newberry County can be cremated without the authorization of the coroner's office. It's a good checks and balance system. There's been several that we've caught that the manner of death is wrong, or there was a suspicious of neglect, especially in our vulnerable adults, and we're able to get law enforcement involved in those situations and have it investigated before we did issue the cremation permit. The chain of command for the coroner's office is myself, which is the full-time position, Chief Deputy Coroner Kevin Worley, and Deputy Coroner Madison Cage, which are considered stipend employees where they get paid a standard amount once a month. Kind of to explain what a cause and manner of death is to the panel is, a cause of death is a disease process or injury that results in death. For instance, disease could be a cardiomegaly, which is the enlarged heart, COPD or renal failure, and an injury could be exsanguination, which is a copious loss amount of blood during a traumatic event such as a gunshot wound. The manner of death is pretty more streamlined for the state. It's determined where or whether the death resulted in natural causes, homicide, suicide, accident, and on occasion undetermined. So when do we get called out? There's 8 times that the coroner's office is contacted by law under South Carolina 17-5-530. If the death is resulted in a violence, if it's a result of apparent suicide, if the decedent is in apparent good health, if they're unattended by a physician during death, any suspicious and unusual manner, any inmate that is in the Penal or Correction Institute and die while they're in that institute, the result of a stillborn death that's not unattended by a physician, and any health care facility other than nursing homes. We do all the nursing home deaths. I have them notify me of the deaths before we release the decedent, just to make sure there's no foul play that put that patient in the nursing home. So we'll talk numbers this year. Our numbers are fairly high, of course, like I think everybody else's were as well. So for 2020, we had 476 calls for service. We had manner of deaths, we had 33 accidents, 2 homicides, 422 naturals. I have one that's still pending from an autopsy in late December, 7 suicides, and 1 undetermined. And the one that was undetermined is, it could have gone both ways. It could have gone as an accident, or it could have gone as a suicide. There was both evidence there to support both manners. Excuse me, and that's why the state gives us the undetermined factor that we can use. For death by natural causes, we had 111 neurological causes, 91 cardiac causes, 14 renal or kidney causes of death, 35 pulmonary, 6 hepatic or liver causes of death, 3 endocrine is usually with your diabetes, mellitus-related deaths, 78 cancer-related deaths. We had 67 COVID-related deaths, which I know is kind of contradicts what DHEC states. If the patient from Newberry County goes to an outside hospital, sometimes that hospital will call us and report that death to us, and sometimes they won't. And we had what we consider 16 other related deaths. Natural causes, these would be our motor vehicle accidents, drowning, suicide. We had 18 trauma-based causes of death, 2 burns, 2 burning victims, 1 drowning. Those numbers are a little hard to read, aren't they?
Yeah.
Sorry. 3 fall-related deaths, 7 firearm-related deaths, 2 hangings, and 11 drug and poisoning-related deaths. And I want to bring up the drug and poisoning rate-related deaths. This year was the first year since my taking office that we have seen a spike in opioid-related deaths. We usually, the first 3 years of my term, we would have 1 or 2, but now we're spiking up to 11. As of so far, I know that we've already had 2 this year. So unfortunately, the opioids are starting to come into our county with a vengeance even more than they should. So motor vehicle collision deaths, we had 8 automobile or SUV related, 1 motorcycle, 3 pedestrians, and 3 others. And what the others are like a train related. We had a train versus pedestrian type related death, and we had 2 boating deaths on Broad River. On Broad River. So death by age. The death by age 0 to 1 was, we had 4, and those are generally our fetal demise, our stillborns, where the baby would have been viable if at full term or had been born. 0 from 1 to 10 years old, 3 from the ages of 11 to 17, 4 from the ages of 8 to 24, 31 from the ages of 26 to 44, 82 from the ages of 44 to 64, 45 to 64, and 337 from the ages of 65 to 100. And those are also going to include, we had a huge spike in COVID-related deaths in October when COVID hit our nursing homes. And that's where a lot of those ages come from. As deaths, certifications of death, 32 and 10% of the deaths this office, so 42% of the deaths that occurred in Newberry County, my office certified the death, and 58 of our medical certifications. That could have been that we responded to scene and we reached out to the decedent's primary care physician and asked them if they would sign the death certificate for us. And if they had seen him within the past 3 months, that was generally not a problem. So there's just a little numbers from 18, 19, and 20. Our accidents and homicides and suicides and undetermineds have been kind of staying the same. But as you can see, our naturals have definitely spiked up when it comes to call volume. So some of our accomplishments that we've had in 2020, despite COVID, Westview Behavioral Center submitted a grant for the purchase of an automatic pill counter, which they donated to our office. I recently wrote a grant and submitted a grant, Paul Coverdell grant, and submitted that for monies for a digital x-ray machine to be used by Newberry Pathology Group. We're waiting for the answer to that. And along on that grant would be 3 new LSR camera. That would be a fully funded grant with no monies having to be matched through the county. Training, we were able to maintain our training hours during the pandemic with lots of online training, lots of Zoom meetings, and lastly, the reporting system, contracting with MDI Log to have a more comprehensive investigative system. So what are our visions for the next 4 years? So to complete the certification test for ABMDI, Chief Deputy Worley was signed up to take a certification test in March, and then COVID hit. So we're still waiting to see how we can get that taken care of. We want to seek provisions and requirements for expansion and advancement of the coroner's office, whether it be through grants and county funding for a combination coroner pathology suites. That also include having a morgue, holding facility, and family viewing areas. Increased staffing due to shortage and increased call volume. Continue to seek the most recent and advanced training. Provide awareness on ongoing concerns in reference to COVID and especially opioids. Acquire equipment that will provide safer and healthier environment for our staffs, such as power lifts to prevent back injuries. Generally, the average weight of the decedents that we're picking up are usually between 180 and 250 pounds, which is dead weight. And thank God for our rescue guys and our law enforcement and EMS that are able to come out and help us load these decedents up. So, any comments, questions, or concerns for the coroner's office?
Any questions from the members of the committee?
I was just curious, the COVID's come under the natural.
Yes, ma'am. Majority of our COVID-related deaths wasn't just COVID. They didn't die just of COVID. They always had some type of comorbidity. And generally, the top 3 that we saw were respiratory issues such as COPD, emphysema, or chronic bronchitis, any type of heart problem. Dr. Rose, who is our forensic pathologist, has saying that she's seeing microscopically the virus getting into heart tissue, and also diabetes, especially uncontrolled diabetes, is what we're seeing for our COVID-related deaths, not just could be having COVID.
You could actually have two reasons for death.
Yes, when you have a comorbidity of that nature, the COVID exacerbates that sickness.
Thank you.
Reverend Scurry, any questions? We certainly are appreciative to your office, maintaining such professionalism, and especially in difficult times like this, and especially such an underappreciated job until it's needed. So we're thankful for what you have to do to deal with the people who are survivors, who have to go through this process.
Well, thank you so much. I
Glad
appreciate
you're
it.
there, but I hope I don't need you.
That's right.
Likewise. Nobody wants to see me.
That's right.
Thank you.
All right, next we have the sheriff's office, and we have, on behalf of, is it chief or colonel, or what are you gonna be this week?
Chief this
Oh, you chief this week, all right. Chief Deputy Wesley Bowden and Major Robert Dennis. And did the sheriff get to come home first? I know that's the burning
Did not.
question the other day,
No.
okay.
He did not get to come home. Well, first of all, we were hoping it was gonna be a good birthday gift for him. Today was his birthday. And we were hoping he was gonna get a nice present and the doctor was gonna come in and tell him he could come home, but that didn't happen. So he is live streaming, I believe, watching the committee meeting tonight.
I think he just sent me a text message as a matter of fact.
First of all, I'd like to thank the council, also Mr. Adams and Tommy Long for allowing us to come up and make this presentation. I'm gonna go through similarly to some of the things that some of us may not know about Newberry County, but also give you some numbers of what we've been dealing with, especially since March. Most of you know our Commander-in-Chief, Sheriff Foster, has been in this office and position since 1989 when he was elected. Although he has been in the hospital, he has maintained communication, whether it's through phone, through text, through email, communicating with Chief Wesley Bowden for any of the progress or problems that may arise on a day-to-day basis. I understand that he also has his radio, so he's able to hear things that go on through the county, which he wants to stay in contact. He wants to, be there for us if we have any problems. Chief Wesley Bowden, he's going to speak tonight. They told me I need to change the picture, but
I look much better back then.
We've aged a little bit, but Chief is going to talk to you a little bit about the technology that we have, as well as some funding that's going to be going on. Most of you know that we've had to move at least 4 times. First, we were housed out at 3239 Lewis Ridge Road, which is the present jail now. We moved to Main Street. We entered that building. That building, as technology would call it, or construction would call it, a sick building. So we had to move from that building to the location that you see here, just to the right of the green rooftop. We had 6 trailers, modular trailers out there that we established ourselves and run operation until the old Armory, old Piedmont Tech came available. We utilize, if you're looking at the screen, pretty much the left half of the building where the sheriff's office is. The front door is our main lobby. We deal with the walk-ins that come in. With 2 ladies that we have there. They deal with reports, that people come in and ask for reports. We also deal with metal permits. On the right side of the lobby area is where we have our 911 addressing, that you would go out there and see Miss Deborah Beard. The front little square building is Tommy Long's office, as well as our communications, where the dispatchers are presently located. Newberry County, we cover 647 square miles, going from the top end of Chapels, where Councilman Scurry lives, to Whitmire, where Councilman Johnson lives, and then down toward the lake where Miss Airwood. We kind of split up into 4 zones that officers kind of take those zones of their area of responsibility. They answer calls in those zones, as well as do property checks. The city of Newberry also has a police department. The town of Prosperity has a police department, and the town of Whitmire has a police department. And whenever they are working, they are responsible for that area of call unless they need a backup from the county. If they have any time off other than the city of Newberry, town of Prosperity we cover, and the town of Whitmire we cover. So if they call in sick or they have any annual leave or vacation that they take, we would actually cover that area whenever they're off. At present, at the sheriff's office, we are fully staffed. We are waiting right now on one individual to go to the South Carolina Criminal Justice Academy, where he will be certified as a police officer. Since the pay raises, we've had 5 employees to retire. That's where they can go out and do whatever they wanted to. Chief Johnson is included in that retirement, and so I think he said he's working harder now than he's ever had to work. But with that, also, we have been able to hire 12 deputies, and that brought our working 4 shifts up to full capacity. We even have split shifts that kind of work an odd time of day from 1 p.m. To 1 a.m. Sometimes we break it to 2. It just kind of depends on some of the actions that we have throughout the county, whether we've got to do some dedicated patrol in areas, or if we have festivals or we have events, as to how we schedule them to work. The main operation for the patrol division is to be highly visible to deter crime. We answer calls for service, whether it's a snake in the house, whether it's a dog that won't allow someone to leave their property. We have warrant services. We do traffic enforcement. We also do business checks, which we call them property checks. So we're doing businesses, residential. If someone goes out of town for several days, we're checking their property for them. We check the government facilities and any public property that folks may have that they're having problems with. The biggest thing that has changed since March is transporting prisoners and mental patients for evaluations. You know, we have to go through sanitizing our vehicles, and I'll talk about that just later on. But if they transport someone, that person that's being transported, whether they're a prisoner or whether they're a mental patient being taken to the hospital, they're given a mask. Although we're sitting in here definitely 6 feet apart, you're in a closer contact in that car. And from all the studies that we're hearing, vehicles are the most dangerous as far as contracting COVID-19. So we take a very a good time that whenever we transport those folks and we get them out of our vehicle, we're wiping down those vehicles where they sit, front, back, or wherever they may be. Each deputy since the COVID, with the help of Tommy Long and some other barring and robbing and stealing, we were able to equip all of our deputies with a packet where they would have a gown, where they would have an N95 mask, where they would have surgical masks, where they would have cloth masks, whatever they needed to perform their job. So they're carrying that around with the additional equipment they already have to have. Some of our stats, just to show you based off of 2019, the total reports that we had in 2019 were 10,286. Yes, we were down a little bit in 2020, but one of the significant changes was that in 2019 we were still writing reports for many of our traffic summons that we were doing for speeding and different things. So in 2020 it kind of reflected that of those reports not being written. We were actually using the summons as that officer's report, so to speak, for him to go to court and present it to a judge or a case or a trial, whatever the case may be. So the total of summons, 2019, we had 3,804, and then for 2020, we had 2,490. I wish I could say about the decrease, what was the big decrease in there. I don't know if it was because of the COVID-19 or just what might be going on, but those are the numbers that we've got this year so far. We also deal with the civil division. We have 3 deputies assigned to that area right now. Last year, they served 2,046 papers, and those type of papers are service of process, any type of legal document, bringing someone that is failing to pay money to finance companies, different things like that. There's execution of orders, ejectment of tenants. You know, that's probably one of the hardest. With COVID, that kind of dropped down a little bit because of the order that was extended based off of the COVID evictions. But I will tell you that these guys, whenever they go out there, they are very respected, and they handle these families with a lot of gentleness and care. I'll never forget one of our civil officers that is retired. He got a Christmas card from a lady that he had evicted that following November. So, you know, it is a hard, but you do find people that understand what's going on, and they do treat them with kindness and gentleness. They serve subpoenas, claim and deliveries, mechanic loans. Liens. I'm sorry, thank you. School resource officers, we have a total of 6 officers that are assigned to this division. They're located at the high schools and the middle schools in Newberry County. However, each one of them, they deal with other schools. The asterisks that you see up there are where deputies are posted. So you'll see that there's 5 of them. The 6th SRO is a lieutenant, so he floats, and he is able to go to all of the elementary schools, communicate with them, any problems. He also has to backfill if someone would call in sick. The other good thing about those schools that don't have someone, we have our own deputies that are riding by there, community-oriented police, Ron Abrams and Sherry Scott. They're going by and checking on those locations too. And the principals, they also have the numbers for each school resource officer. They know who's assigned to their school, and they can immediately call if they need someone. If it's a real emergency, they'll call 911. In investigations, we have 1 victim's advocate, 6 investigators. They investigate drug violations, larcenies, burglaries, assaults, murders, scams, basically just being an overall problem solver. You'll find that that's a lot of what law enforcement is, because when folks call in, they want law enforcement to solve a problem for them. The investigators, when they work these cases, if they make an arrest, they have to testify in magistrate, general sessions, and federal courts. Works with surrounding law enforcement agencies, both local, state, and federal, to bring folks to justice. We still feel confident for Newberry County having the lowest crime rate in South Carolina. We do have a great clearance rate, and that clearance rate is based off of that last slide and last paragraph that I said, working with local, state, and surrounding agencies. When we have something to go on here, we're calling Lexington, Richland, Fairfield, Union to find out if they've had something similar. That way we can work together. We also work with putting together programs to kind of help people understand. We've got some pamphlets that we give out that you can check your house for burglary, readiness, so to speak. Although our pamphlets are not 100% guaranteed to keep your house from being broken into, but it gives you some good points of what we need to do, such as making sure you got some lights to stay on, through timers, cutting back bushes. If you're going out of town, let someone know so that we can do a property check or let neighbors know. The Newberry Detention Center, as you know, the sheriff picked that up many years ago. At present, we have 28 employees on staff. Right now, we only have 3, we only have 3 openings. The daily average we have in the jail is 60. We would have a little bit higher number with that if family court was in session. But because family court is not having any in person, we're not dealing with the deadbeat dads that are being sentenced to jail. The other thing that I put up there that I think is very important for the council to understand is right now we are detaining 10 Newberry County individuals who have alleged and are being charged with murder. One of those, which makes it 11, we kind of swap off from counties. We can hold one of their persons, and we're actually holding a murder suspect for Lawrence County. With that being said, that puts the individuals at the jail in a full-time readiness mode, where they've got to be physically fit, they've got to visually be able to monitor these inmates and be able to react to problems. Today, this morning when I looked doing this PowerPoint, we have a total of 59 in the jail right now. 911 dispatch is 24/7, 365 days. We receive all emergent and non-emergent calls. The call volume for 2019 was 25,390 total calls. That is landline as well as cell phones. And I will tell you, cell phones is probably about, I would guess, probably 90% of what's coming in now. 2020, 24,365 calls that have come in. So you think about those calls that dispatchers are having to answer. They're also having to listen to 32 radios. Everybody that's sitting in here is equipped with radios in the vehicles. Fire, rescue, EMS, highway patrol. Although we don't dispatch for highway patrol, we monitor their radio and we can communicate with them if we have an incident here in the county. Some of the other things that we deal with, at present, we register 102 sex offenders that live in Newberry County. Each sex offender has to come to the sheriff's office, and their fingerprints have to be taken, their photographs have to be taken. There's about a 6-page packet that has to be filled out, verifying their home address, verifying their employment, verifying website information, internet access, and different things like that. Once that is complete at the sheriff's level, sheriff's office level, then it has to go to communications where they are entered into a crime computer, and there's checks and balances in that. So it's kind of a two-based going from the sheriff's office and going to communications that we have to deal with. Some of the other services that we do car seat safety inspections. We do community talks, dealing with scams, identity theft, home safety. We still run the meal delivery route, assisting Newberry Council on Aging. Last year, we did 322 concealed weapon permits. Folks come to us to have their fingerprints made so that they can send that to SLED and get their concealed weapon permit. And you can see there's more gun-toting folks than there is teachers. We only did 12 last year. When COVID hit, the top picture on the left is my closet with gloves and Lysol and alcohol. That bottom picture center, I have to give a shout out to Metal Masters. Whenever we started kind of coming together and the demand for hand sanitizer and the stands were out there, we were not being able to get them. So we went up to Metal Masters. They were able to engineer that stand for us so that we can put sanitizers at the sheriff's office, at the courthouse, and other places throughout the county. That was done at no charge. They made 10 of them for us. So we thank them very much. The other thing that you see in the top right-hand corner is a piece of plexiglass. That is the new business at the sheriff's office whenever we take walk-in complaints. Folks will come in to file an incident report, excuse me, and we have to have that shield between us as well as wearing masks. The employees, much like what you went through tonight coming into the council chambers, we're taking temperatures. There are questions up there asking if you had any symptoms, taking your temperature, and signing in. If they have any symptoms such as a temperature that may say 100.6, they've got to kind of back off, take just a minute. It might be that they just need to cool down and then retest. I'll use Mr. Scurry. He had his hat on whenever he come in. So we had to take just a moment to cool him off with that hat, and he was able to come in. Some of the things that, dealing with COVID, we meet on a sometimes daily, but at least a weekly basis with Tommy Long. Whenever the sanitation came out there, I'm gonna skip ahead and back up. That machine there, which is a Ryobi fogger, we were able to find one at Home Depot in Columbia. We were able to secure that at $99 in March. Now that machine costs well over $400. Am I right, Tommy? So we were able to get one and save the county a lot of money to start sanitizing. You'll see up in the top corner, we were able to purchase through Tommy Long thermometers, just like the one that y'all utilized whenever you came in. We had to put that up at the sheriff's office, at the detention center, at the magistrate's court, here at the annex, and then over at the courthouse. I still foresee us having funding. We've got the backup handheld. But I foresee us having to have more in place as we continue to this. A daily basis at the sheriff's office, we're sanitizing the lobby, all the offices, computers, phones, common areas, bathrooms, classrooms, all the doors that we come in contact with. We're sanitizing those to make sure that it's ready for the next day of business at the sheriff's office. So we've not only gone from dealing with criminals and public, so to speak, but we've now had to take the protection of our employees as well as the sheriff's office to make sure it's ready for our employees and the public coming in the next day. During the past 2 months, the detention center, 911 dispatch, the sheriff's office, we dealt with several employees out with the COVID. For those that were not affected, each one of those stepped up to work overtime and fill in the gaps. You know, it's without saying that the county is truly blessed with the dedicated employees that keep our office up and running without missing a beat. So a great shout out, not only are we doing it at our level, but we're also doing it in here for the employees of the Newberry Sheriff's Office. I think that's all I had written down. One of the things that we wanted to ponder is although now we have a new president, we've also looking at some changes in the local government, state government. We need to keep in mind about the possible increase in gas prices that are steadily on the rise. I know there's also some talk about the minimum wage and different things like that, and often that's going to affect local government. So we would ask that whenever you start looking at all of our agencies as a whole, emergency services, that you kind of keep those things in mind too. And the last thing is if you got a number whenever you came in, if you'll leave it on the desk behind Ms. Fellers, that way Taylor can reuse them.
I got a couple more things to cover. First of all, I want to make sure y'all know that the sheriff's always worked to be a good steward with taxpayers' money. we've worked with Mr. Adams and the prior councils, even throughout the budget year, if things need to be cut to try to make the ends meet. We've worked that, and I think the pay raise that Mr. Adams and the prior council was able to help us get really took us out of a dark spiral. We were down at one time 9 deputies, and just trying to replace that was mighty near impossible. Mr. Adams and the prior council worked to raise those salaries, and thankfully we're about back up to where we need to be. We're still training, of course, but we definitely came a long way. The other 2 things that I want to bring up, mainly technology-wise, that we want to plan for. Our 911 system is currently outdated. It is not supported anymore. So we need to work to get that covered in this coming year. It needs to be worked, and we got to have equipment replaced. Also, in 2025, they're going to start running a upgraded radio system that we're going to have to buy the flashes to upgrade our equipment. At the county's numbers, including just the county's EMS, fire rescue, sheriff's office, coroner's office, just the county entities, we'll be looking at $241,000. So my suggestion in that is we work to cut that down yearly and not one lump sum, because it will take hands-on every radio to do that. So we can work that. Now, that still does not include the cities and the towns' radios that were bought on the penny sales tax. They'll be responsible for theirs. I'm just talking county entity. So I appreciate y'all's time. Questions, comments, concerns, anything I can answer for you?
Any questions?
Well done.
We appreciate very much the dedication of the Sheriff's Office and our law enforcement. We are very blessed indeed. Next, we have EMS with Corey Bishop, who is my hero, and Bridget Parsons, who is the beauty of the team.
We're going to tag team this. We're going to first start off with EMS, and then we'll transition over to the rescue squad. So it's always fun for me to come up and speak about EMS because my family background is in public service. I love to talk the stories with my dad because at the old hospital, he was one of the orderlies that went out and picked up the patients and brought them to the old hospital. But I joined EMS back in 1994, and at that time, we had 2 24-hour trucks that covers this whole entire county. And today, we are blessed enough to have 4 ambulances, 1 transport truck, and a QRV unit. So let's see, where's our folder? So in 2020, EMS responded to 6,029 calls. Now the stars up there indicate where our main 911 units are located. The Medic 1 unit is located in the central headquarters region in the city of Newberry, and the Medic 2 unit is located in the area of Silver Street. The Medic 3 unit is at the Lake Point, which is at the Fairview region, and then Medic 4 is now the Indian Creek area. All of those trucks, we have 3 that are staffed 24 hours, and we have 1, which is Medic 2, that is staffed every day, Monday through Sunday, from 8A to 8P. What I wanted to show you guys too, just as a glimpse, is I worked on some quarterly data that we'll be going through, and to show where the call volume is originated. As you can see, the largest volume is in the city region where the Medic 1 unit primarily responds. And of course, from there we have Fairview that responds to 17.4%, headquarters, which responds to 69.13%. The Indian Creek area, which responds to 7%. The out-of-county, which would be the transport unit picking up a patient that we had taken up maybe for a CT scan out of the county back to the hospital, responded 0.78%. Home area, 2.03%, in Silver Street, which is 3.66%. And that was the call volume from January to March. The April through June numbers, Fairview was 16.81%, headquarters was 68%, Indian Creek 7.35%, out of county again 0.41%, and Pomeria with 3.07%, and Silver Street 4.36%. Third quarter, which was July through September of 20, the percentage of the call volume was Fairview was 15.84%, Headquarters 68.14%, Indian Creek 8.33% out of county, which is 1.14%, Pomeria 2.39%, and Silver Street 4.36%. And then to close out the 2020 year, October through December, the Fairview region, we had 17.40% of the calls, Headquarters 69.13%, Indian Creek at 7%, out of county 0.78%, Pomeria at 2.03%, and then Silver Street at 3.66%. So it's been a very, very, very busy year. We've had several employees that have been out due to COVID and to illnesses. But our staff, when we're fully staffed, we have a 40-person team. When our employees range anywhere from the Greenville area to the Columbia area, and we do have some local employees as well. So one of the reasons that we also have our Avl system, which is a mapping navigation system that has been very important to us for multiple reasons. Number one, it helps those that don't live in this county navigate to the call the quickest route. But it also, we use the Bluetooth unit that helps us transmit our EKGs to our cath-capable facilities to get the patient where they need to get from the get-go. So in review, there's a couple bullets here. There's a lot of things that we have done in 2020, but I just wanted to highlight a couple things. One of the things that I noticed when I sort of stepped into an interim role back in June was there was no mission and vision statement for the agency. And I'm very passionate about a mission and vision because I believe that supporting and leading a team is very important to have a mission out in front, and so the team should be able to see it as well. We also, through our capital purchase, we purchased a LifePape 1512 lead EKG monitor, which was around was budget for $30,000. And that helps us bring EKG monitoring bedside to those patients that are having an acute cardiac event. We could go ahead and do a 12-lead EKG, see if they're having an active heart attack, and take them directly to the cath lab instead of just taking them to the local ER. And third, we delivered the delivery of 2 EMS Dodge Ram 4500 units with Stryker power load systems, which has been very awesome for us to be able to have. And those trucks have saved our backs as well from the days when we started. We had to lift those patients directly from the ground, and to be able to now to help us get those patients onto the stretcher and load them, the system loads themselves into the ambulance. Implementing more structured, new hire field training processes and training. One of the things we identified is that we have employees that come in from different counties and different agencies, and we don't do everything in the same method that they do in other agencies. And being able to set our employees up for success. And when you set your employees up for success, you set your patients up for success. And finally, we implemented a revised progressive standing order and protocol supported by our medical director, which is Sean Amera. We are on the cutting edge at Newberry. I would put our system up besides any other agency within this state or in this nation. I mean, we're really out there doing such progressive pre-hospital medicine that is changing and saving lives. The days where we just throw the patients in the back of the ambulance and take them to the hospital are long gone. What we're doing now is bringing the emergency room to the patient's home. And that is, time is muscle, and it's really making a tremendous difference. Just this year alone, we are seeing patients that have been in cardiac arrest walking out and having viable lives. Some of our objectives for 2021, we are looking at ways to save and reduce cost and doing things smarter and not harder. One of our top visions is revising our supplies. Our DHEC regulation 67-10 is making some changes this year. And one of the things we want to do is to be able to decrease the things that we have on hand. Especially, currently, we're able to make our purchases from a hospital purchasing department, which is right across the street. So it doesn't make sense for us to have those items stocked at our station when we can just go directly across the street and make those purchases and not overstock. Also, we want to continue to seek innovative and progressive field care and management to be a premier agency. And that goes in line with our mission that we established and continuing to grow. There's January the 1st, we implemented this new protocol that was just revised. And our medical director is for us. And him and I meet on a monthly basis. And we talk about, what is new, what is cutting edge, what is some things that we can do, what is some things that make sense, what is some things that could sustain and change lives. And we met today, and we have so many other things that we're discussing to bring into the county. We want to continue to measure county growth and effective EMS coverage, structured research on shoot times, response times, scene times, transport times, and turnaround times. One of the things that we measure also on a quarterly basis, and our goal is to bring this information to the forefront of our team and to control the things that we can control. Our shoot times is how long it takes from when our call is dispatched to when our wheels are moving. Those type of things. But looking at numbers and seeing, our transport times, how long does it take us to turn this truck around to become back available in this county? The response times, how long has it taken us to get to that patient's bedside? Or we strategically have these ambulances placed where they need to be is very important in the grand scheme of things. And looking at the employee recruitment and retention plans to assist with departmental growth to combat EMS national shortages. Currently, there are EMS positions available nationwide. There is a shortage on paramedics. We currently have 3 paramedic positions open now. One has been vacated for months now. So just trying to recruit and retain those employees to our county is very important. We're a very small agency, but we're a very family-oriented agency. And what we do is we try to look for things that we can give our employees that other agencies can't. One of our benefits that we do is we look, you're not a number, you're a name. And a lot of our bigger agencies that are surrounding us, yes, they pay more, but do they care more about you? So being able to give that personal aspect and relationship to our employees is very important to us. And finally, the remount, which was approved in our last budget for this year that we're working in now, is our 2009 Ford 450 ambulance that will be going for remount any day now. So talking about review, this is our mission statement: innovative and premier advanced pre-hospital care to the citizens and the visitors of Newberry County. And our vision: making a healthy community through cutting-edge pre-hospital care and disease prevention through education. Community education is very important to us. We do multiple up until COVID, we had established a relationship with a county council on aging group in Little Mountain that was meeting at the post office. And that little elderly group loved for us to come. And we also had established with the rescue squads free CPR classes that was happening from month to month that would move from each region of the county. So being able to get back into the community and do education and employee recruitment and retention is very important to us. Our capital purchase was for this particular monitor here, a LifePak 15 12-lead EKG monitor defibrillator, which is capable of Bluetooth transmission capabilities. This machine here has saved countless lives. This is a picture here of one of their current ambulances that were received last year. This is the 2019 Dodge Ram 4500 with the Stryker Power Load stretcher system. training and implementing of our standing protocols is very important. The things that we're doing today is so advanced and so progressive, and the key to it all is to train, train, train. We've implemented a more structured new hire field training process and training standards for all staff with that continued education to help us keep abreast of the new technology, and implemented a revised and progressive standing orders and protocols supported, again, by our medical director, which is a hands-on to all the training that we go through. Where are we going? These are our objectives for this year. Continued revision of our EMS supplies and stocks, and to continue to seek innovative and progressive field care. To continue to measure county growth and effective EMS coverage, doing the research and data collection of shoot times, response times, scene times, and transport times, and turnaround times. And continue to seek after employee recruitment and retention plans to assist with departmental growth to combat, again, our EMS national shortage, and the completion of our 2019 Ford 450 ambulance remount. Recruitment and retention plans. Any questions, concerns, comments?
Any questions? Any questions? Thank you very much for what you do. We are so appreciative and so blessed, and we know that on a national level, we're seeing even more stress being put on crews where they're deciding who's going to make it or not, whether they transport. And so we are so in prayer for you all as you do such a great job for us. All right. Corey, I think you get to keep the stand. Is Nat here with you?
Yeah, I'm
wonderful.
I appreciate you guys having us on council, Mr. Adams, Tommy, to kind of show what we're doing with the Board of Rescue. On behalf of our chairman, Nat Byercheck, he regrettably couldn't be here this evening. He had another engagement, so I'll be speaking on his behalf. A little bit about what's going on with the Board of Rescue. You know, we have 7 independent rescue squads. They're supported by the county, and I served for the last 3 years as the chairman of the Board of Rescue. I recently stepped down as I was appointed to work with EMS, and I'm serving as their director at this time. Very, very fortunate to have Bridget as our chief of operations, and she has done a fantastic job with EMS. So you'll notice that these two kind of mirror each other. One of the biggest things that we're wanting to push, and I'll get into this, is to work more symbiotically together. If you look at call volume for the county over the last year, it's in the numbers pretty small, 4,695 medical calls dispatched over the county, and this kind of shows a layout of where the calls are generated from. Again, you can see the main concentration in the city portion of the county, as that was evident by her slides as well. You also have the total number of fire calls, and if you look at that, that's 648 calls dispatched over 2020. And the reason I put the fire calls in with the medical calls is because the rescue squads serve in a multitude of roles, that being medical transport capability, first response capability, and then a force multiplier when we have calls out with fire service to work in a rehab role, and then also transport medical patients. And so a lot of times, unless it's something minor, any kind of structure fire, anything like that, we're going to be going out with them as well. So there's a sizable number of those calls in which we'd be dispatched. Looking at our 2020 in review and our 2021 objectives, a couple things that we were able to accomplish over the last year. One thing is again, looking to be good stewards of the money that we are receiving from County Council. We're trying to look and put in some more business principles in how we manage the departments, and trying to manage the departments more seamlessly and as a singular unit instead of 7 independent agencies. One thing that we have done is oxygen consolidation. We looked at a capital purchases of Zoll X series cardiac monitors. We took delivery of another medium-duty rescue truck that's housed at Lake Murray. And then we started late 2019, and then with Nikisa, which is what we integrated 2 of the departments under a singular license instead of all being licensed independently. And we've now rolled that into 4 departments, and that consists of Lake Murray, Little Mountain, Newberry, and Chapels. And then we're working to integrate the other departments as we can so that we're all functioning under one single license, one set of standing orders, one medical control physician. Everything, all of your protocols and everything now becomes one instead of 7. The other thing that does for us is allows us flexibility in where we are responding, because we are licensed by DHEC for each agency. It's when we combine that under one agency, it gives us the ability to move throughout the county and run and transport with those other departments. 2021 objectives, and we'll go into these further, is for further reduction of redundant expenditures, piloting a Newberry County Community Health Medic Program, and then development of training programs to integrate us with stronger ties to work with Newberry EMS. Going in a little bit further, like I said, Nat Byercheck is our chairman of the Board of Rescue now. What we wanted to do was look at redundant expenses, and so as part of our consolidation, we started with our oxygen storage and supply. We used to store oxygen at all 7 of our departments for uses on the trucks. We decided to consolidate all 7 to one singular location. That reduced the redundant supply, and I actually made a typo. We saved approximately $31,000 a year just by reallocating and streamlining our oxygen supply. When you're working on a budget of $300,000, $31,000 is a pretty substantial chunk of change in that. And all that took was just some cooperation and working together and looking for cutting waste. Another thing we were able to do is a lot of us use Zoll series monitors, but we had several different monitors of different types, different ages, different makes and manufacturers, and that creates the possibility for error whenever you step into somebody else's truck with a machine that you're not familiar with. As most of our cardiac monitors were reaching their end of life, we were able to work together and work with the county to forfeit 2 years of our capital purchases or capital allocated monies to go towards the purchase of the new Zoll X Series cardiac monitors, which is very similar to the the LifePak monitors the EMS uses, different manufacturer for county versus hospital purchasing groups, and that's why it's a separate monitor. Has all the same functionality, 12-lead EKG transmission, continuous waveform capnography, AED, cardiac monitor mode. We were able to purchase 6 of these monitors at a bulk price. It saved us approximately $3,000 per monitor for the trucks. And by agreeing to all go with this at the same time, forfeit the amount of money, moving forward, we were able to get this at the bulk rate and save substantial monies there, and also get an improved and great quality product on the trucks. We were able to conclude and take delivery at the end of November on a medium-duty rescue truck that is being housed at Lake Murray. We're awaiting a couple of final augmentations from the company, and that should be operational in 1 to 2 weeks from today. As we move into 2021, again, we're looking for redundant expenditures, especially not so much for each department, but what are we doing between the 7 that we can reduce and consolidate to 1. A lot of that is going to be supplies, just like what Bridget was saying. I said you'll see a lot of similarities in what we're doing as we try to work more singularly, EMS and rescue, and moving forward. Cutting down the number of supplies that we keep at the stations, keeping all that at a central location at the hospital. We purchase the majority of our supplies through the hospital purchasing group as well. That gives us better pricing than what we could get individually as the county, unless the hospital can't support it, and then we purchase that through Tommy and the county. Another thing that we're working on is developing joint training to better integrate what we're doing, putting our people in front of each other and working together. I think anybody in this room that's speaking tonight would say the same thing, in that we are incredibly fortunate in what we have throughout the agencies in this county. To be able to walk into a room, know the people that you're looking at, the continuity of leadership that we have in this room, and I'm not speaking just from the rescue, but from every entity here, is absolutely phenomenal. And to have that and be able to maintain that, work together, train together, we truly have a very special thing here in this county. And just as Bridget said, there's no large county, small county, that for the size that we are and the people population that we serve, there's nothing that we can't offer, and I'd put us against anybody. We have great things in the works. COVID slowed us down a little bit, and how we were meeting the plans that we had moving forward. We're working on a lot of county projects, a lot of county training But we have worked through that. We have moved on the rescue side, as most of the county. A lot of our meetings are now done virtually. Training is done virtually when it can be. If it can't be avoided, then we meet, we put in all the social distancing guidelines. And then how we're adapting and moving forward with COVID, same thing as what the Sheriff's Office does. All of our rigs are decontaminated, terminally cleaned after transports, especially with COVID-19 transports. We have higher cleaning protocols. And we've also dealt with a lot, not only having all of our trucks out, but also going out of county and dealing with a lot of diversion from hospitals. A lot of the hospital ERs right now are at capacity. They're staying at capacity. They don't have beds to put patients in. And so getting the patients where they need to be in a timely fashion has become more difficult than ever, not from our response time, but trying to get them where we can find a bed for them. And that's become an everyday battle that used to be once every blue moon. It's not unusual for us to have all of our area hospitals outside of Newberry to be on diversion for days at a time. As we move forward in 2021, like I said, continuing to work on our training and working together. We have a unique opportunity between me and Bridget that we've both been residents in Newberry County all of our life. We're ingrained in the community. We're vested in the community, and we're vested in our people. We're here for the long haul, as most of the people in this room are. The leadership, like I said, there's great continuity, there's great support, and so we'll be working to make sure that we provide our people with the best training that we possibly can. Another area of focus that we have moving forward with the rescue service is looking at preventative care and surveillance for underserved populations as we look at how we continue to be, again, a force multiplier and a quality service for the county. One of the things that we're doing is piloting a program. This is actually being done through the Nikesa Lake Murray Station, where we are basically working as a community paramedic program. We're looking at doing this for EMS as well and looking to do this for other stations, but we're going to pilot and run this through Lake Murray. Basically what this will do is go out to at-risk vulnerable patients that are identified through either hospital social service means, us running calls in that area previously to those addresses where we have what we call frequent flyers, especially if it's non-acute issues that we see repeatedly, that we can go out and provide preventative care, whether it's identifying needs in the home for fall risk, nutritional risk, social service needs, whatnot, and we can try and avert some of the issues in transporting these patients over and over to ERs and clogging up ERs, especially right now with the large COVID volume that we're seeing, and help do this at no cost to the patient and possibly reduce their ER visits, reduce the number of 911 calls that we're having to take to these areas and such. So we actually are identifying and building our client base as we speak, and we have our first client visit in about 2 weeks. And those are going to be based on just kind of what the client's needs are. Some of those we'll be seeing once a month. Some of them we may be seeing 1 to 2 times a week, just kind of based on what their needs are. Just another service that we can offer. We've done this in conjunction with the state and with DHEC. We see ourselves as a positive force multiplier, a cheap insurance, a backup for EMS, and a forward provider in the field in a separate way to provide that preventative care on top of the emergency medicine. Like Bridget said, the standing orders and the protocols for EMS are really phenomenal, top-notch. The care they're providing, the skills that they're able to do in the field are the best in the state. And we don't want to settle there. We want to continue to push forward, and that's what we'll do. We appreciate your support. I'm happy to take any questions you may have.
Any questions from the members of the committee? I would just, based on my background, the eliminating some of those redundancies and creating standard operating procedures across the county are long overdue. And I'm just excited to see those going in, and I thank y'all for y'all's effort in doing that.
Yes, sir. Thank you.
I thank y'all for your efforts.
Yes, ma'am. Appreciate it.
All right. Before I let you gentlemen come, we've been about an hour and a half. Are y'all okay? You need a break, or we wanna move forward, continue forward? I got one okay, and I got another okay. All right, go right ahead. We go back to the mind can't comprehend any more than the hind end can withstand, and so. Okay. So this is, yes, sir, Tommy and Chief Minnick and Gene Shealy, who are gonna talk to us about the Newberry Training Ground.
Thank y'all for your patience tonight. We're throwing a lot of information at you. But we felt like it was a lot of good information that I really need to know. We're gonna talk about the training grounds, which is the old fairgrounds, which we're converting over to the training grounds.
You need to get the mic so people at home can.
Okay. I can't see this. All right, is that better? Okay, this is kind of an overview of our plan as far as how it's gonna be laid out. Some of these things are already in place. So we're gonna talk about some of the existing assets we got out there and some proposed items and some initiative projects we're working on. I'm gonna do a little I'll point it over it. So these buildings here are already in place. The burn building is gonna be in this location. Flammable gases, props eventually in this location. Hazmat in this location. Our pump testing facilities for our fire trucks in this location, and possibly 3 houses built at different stages in this location. And this is a power line. And this is a simulated roadway. And our driving course is going to be out in this area once we get to that point. So what have we done so far, or what do we have in place so far? We've done some tree planting out there, which I got to get the next slide. We've done some tree planting. I got some slides to show you some pictures. If you hadn't been by the fairgrounds, you can see we've cleaned it up quite a bit, and it looks a little bit more attractive than it has in the past, keeping the grass cut. We've had Preventative Pride grant that we was able to get some trees from that we've planted out there to make the grounds start looking a little better. And like I said, we cleaned the grounds up, and the building inside of the buildings we've cleaned up. We're working on some props inside of the first barn for our firefighters and our emergency personnel to use for training. We'll get into that a little further in just a second. Confined space prop. We've got a training room in the front building, which used to be where the fruits and vegetable stands were at back in the day, if you remember that. We've made a training room in that little room up front. We're in the process of getting it finished up. We've got the HVAC in there. We got a TV and internet access for our training. And we're also working on getting the bathrooms totally revamped. So here's some pictures of the work in progress on the tree planting and improving the way the grounds look. I'm going to let Keith kind of go into the construction of the props and so forth.
Thank you, Tommy. And very fortunate that we're able to partnership and have something that's very long and overdue with a centralized training facility. And you know, as we look at this, as it's not just fires, rescue, law enforcement, EMS can all come together and train in this setting. The first building that you saw, the enclosed building, we went in and with staff help, Captain Andrew Marsh and Captain Shealy kind of head up some of this as well with other agencies helping to build props inside. So basically we took some pallets and make like a make-do house. In the fire service or even in the law enforcement world too as well, you always simulate what you're doing. You have to simulate forcing a door, simulate collapsed roof, simulate search and rescue, and so the firefighters can only be as good as how much they put into the training to be able to form at that 2 o'clock in the morning evolution. So inside this building, we're able to build several props. We hosted it was open to the whole county, a company, Alpha Company engine school training out there where we was able to flow water and do very different scenarios with flowing water and pulling lines through structures, as they call it, the nozzle forward. So a lot of work has been going into cleaning the building up and getting it where we can use, gathering up old carpet. So if you're taking carpet out of your house, we'll take it and we'll put it down on the ground, which helps protect the gear and air packs from the concrete. So a lot of the stuff out here has been donated and given to us to be able to assemble these props throughout the building. Bathroom renovation has been going on. Tommy's been heading that up, and Irvin getting that bathroom at the entranceway where the old ticket booth used to be for the male-female bathroom. Having somewhere that folks can use the restroom when we're training is a necessity. And so this actually have showers in it. The showers are already there. They're just being refurbed. And those showers will hopefully, as the burn building, Class A burn building gets put into perspective, if somebody needs to take a shower afterwards, they're able to do so to rinse off where they go home. Inside the current, we again, search and rescue, fire attack, Mayday training, some of the things that we practice if a lost firefighter gets lost or disoriented inside of a structure, they'll practice that Mayday training. Auto extrication has been done out in the field around back. We've been very fortunate to have the PMR across the road, salvage yard, as well as Kibblers and Mark Hip and other agencies be able to donate vehicles to us or tractors to use for extrication props. These have been given to us and donated to us to use at their discretion. They'll drop them off, we'll use them, we'll tear them up, we'll cut them up, we'll disassemble them, and then they'll come back and pick it up for no charge. And so kind of a win-win. As Corey was talking about the relationship, it's about building relationship and having that partnership. Driving training, we've had in the past two emergency vehicle driving course training. It's a 40-hour course. It's held through the South Carolina Fire Academy. The students attended at the EOC classroom portion, and then we'll go out to the fairgrounds and do the driving portion that we're hoping eventually to be able to make a concrete pad out there, because the ground does pump with those fire trucks running over it several times. Skills development stations, as talked about, the Alpha Company school, engine school that was out there had different skill settings set up, and that allows you to break off in different groups. For example, we can put people in here to do search and rescue. We can have a crew outside doing engine company operations. You know, as we work on active shooter stuff, this is something that you can even do in the future to practice with law enforcement and fire and EMS and rescue on those type of scenarios as well. Some of the proposed assets, of course, we're in the phases now, and I'll show you a picture in a second with a Class A burn building, and also it's got a built-in confined space prop. One of the things that we're looking at for the future with the relationship back and forth is a future larger scale confined space prop. The driving area is there. We just need to maintain with the gravel and the base. Highway extrication pad. You saw earlier, it's more or less a lot of the calls are on the interstate. Setting up blocking, barricades, the cable that we run into, working with our partners in fire and EMS and rescue of extrication on the interstate, highway safety. Flashover simulator is something in the future we're hoping to get to teach the flashover to firefighters how to recognize and identify that type of environment when they're inside of a structure. The 3 residential houses that Tommy alluded to is something that in the future we'll be able to have, so you can show firefighters the stages of those facilities as you go into a house to disassemble. As a firefighter, you really need to know basic construction types of a building. If you go in searching for wires or into a ceiling, it's a suspended ceiling or concrete wall or whatever the case may be. So those are props in the future as well. Underground electricity, city utilities. We're working with co-op and city utilities to help us with props in the future for down power lines or services to houses, pulling meters, even with the gas authority with gas props as well, and help tidy up some of that power out there as well. If you've been to the fairgrounds, you'll notice a lot of different lines running through there, and so hopefully in the future we'll get that tidied up and better looking and better use as well. Pump testing site, of course, to run the fire truck, you need to know how to pump it, test it, and be able to flow lines. And of course, we use at Friendly and Pomeria, 2 test sites, but really and truly updating those sites to be able to carry the 2,000 gallon capacity trucks at one time and keep those trucks in service. Repaint the roof is something that has to be done at the facility. Fencing is there, but needs to be a little maintenance done to it. Skid steer is out there to help us move stuff around. We're actually looking at now through a loaner program, a piece of equipment to help us move that around at a very, very low cost. This is actually the burn building that's being built up in Illinois now through American Fire Training Facilities. That's the county and some grant money and LEPC money has come through. This is what the building will look like. It's 3 stories with a roof deck, confined space, rappelling prop, fire sprinkler system, built-in roof props, Denver drill. I mean, I can go on and on of what a firefighter's dream of being able to go out and do some realistic training day in and day out. The beauty of this is, if you know, Whitmire's had a burn building for many years on a grant, and it served its purpose. But this being centrally located, new style of props built into it, I think you'll see another 30 years of life and more in this building. And when you start talking about the number of firefighters, rescue, law enforcement, emergency responders you have across the county, you break that down, pennies on the dollar when you talk about the investment you put into this building. This is a flashover simulator, and again, it's just designed to teach firefighters how to recognize, identify inside of a structure, especially in new style constructions where your flashover rate is more potential in a fast flaming fire, and being able to recognize that is just another simulator to be able to add in the future. Initiative and projects, Propane Props. We've had one of our local agencies here in the city donate and give us a propane prop. They actually came out to the training grounds several months ago, right when COVID was starting, and put on at no cost a propane training prop, a live fire simulation. They furnished the fuel, they furnished the prop. We're hoping that we're going to expand that a little bit more with some more props through them. We've taught natural gas with Clinton Newberry Natural Gas of assisting with some props with natural gas. And then, of course, Hazmat and power companies, as well as a road name project, just to give people true simulations as they're responding to a call. This is actually a picture of one of the propane props that was given to us and put out there as well. And this last slide, there it is, didn't come up. So again, the training ground has really come a long ways. If you hadn't been by there, please go by there and look. We'd love to take you on a tour to see what the buildings are and kind of walk the sites and show you the plan again of how we vision the training site to become more of a reality. Search and rescue in that wooded area is a possibility. There's so much to do with that training facility. We've been very fortunate, even with this burn building, with several donations coming in as far as helping with the grade and the concrete and the finishing of the work. So again, you start talking about saving money, your community really supports your emergency services. And when you start talking about fire and rescue and law enforcement and they see what it's going for, they'll step up to the plate and help. And it's been very beneficial to us as well. So we're excited to get that up and running, and certainly we'll entertain any questions you may have about the training facility.
I've heard about it when this was being implemented, but it's nice to see what y'all already done with it.
It'd be nice when it is done.
Any questions? Just amazing, amazing stuff. So we appreciate you sharing that with us. I would take a quick side note. I think I talked with Taylor about this earlier. I was approached by the Newberry JCs about using the parking lot for a food truck day. And Tommy, I talked to you offline, and you didn't seem to have a problem with that. Has that opinion changed at all in doing that?
We don't see a problem doing that at all.
Okay, is that something we need to vote on as a committee, or how would you like to move forward with that?
What kind of insurances do we need? Liability insurance?
The COL, COI, yeah.
I don't, as long
Think-
as the committee's okay, I think we're fine. Jake could work a food truck, he's worked a lot.
All right, we'll let facilities management handle it, knowing that we're in agreement with it, then we won't call it to a motion.
And if you don't mind me elaborating one thing, because I think I left something very important out, as we get this Class A burn building up, when we went through the process, we contacted South Carolina Fire Academy as well, because we're gonna get them to come up to certified, to allow us to continue to have, classes here, and Gene Capsheila hit on that in just a little bit, because if we get it certified through the academy, as we teach here, we don't have to send them to the academy in Columbia, so we can do it more feasibility to meet the volunteer schedule here as well, 2 nights a week and weekends to get that certification. So that's a very
That's
big
great.
part as
Huge
well,
asset.
is moving volunteers around the state to get trained.
No question,
Right.
no question.
Thank you, sir. Amen.
Incredible job, gentlemen, thank you.
Thank you.
I think Chief hit on it very well. Recruitment and retention is obviously a difficult time right now with volunteers, not just in Newberry County, but across the nation. And part of what I wanted to do when I came in is make sure we had training available locally for these volunteers. Volunteers were having to leave the county to get that training, which was very difficult. And we've already seen early on the benefits of this new training site, and I'll kind of go through that in this presentation. I apologize. I know we got new members on this committee, and I've been here before presenting to the older committee or the other committees, and so I didn't really prepare a PowerPoint for update recruitment and retention as far as where we came and where we are today. So I apologize. It did tell me to keep like 5 to 10 minutes, so I'm gonna try to keep that going. As we look at 2019, 2020, our recruitment marketing plan, we actually put a budget together that was not funded through the county or the city. And I understand with recruitment and retention being a new idea to Newberry County, it's hard to find those funds. So we actually reached out for a regional grant between Newberry County and Newberry City. And that was a safer grant. That grant was actually over $300,000, and I'm not gonna go into detail with that, but that was some big ideas, scholarship programs, LED signs for these stations out in the county so we could actually advertise by every station in every community, putting a recruitment program together that would actually be for that community in particular. In the past, we've had the grant money that we had came through the city of Newberry, and therefore any material that was developed from that grant money had the city logo on it, and it was very generic, and that is good. But at the same time, we know that communities want to put their name on those recruitment ideas because of the pride of the service and the community orientation. So that was something we were looking into. But social media is obviously a big contributor to our marketing program, and Newberry City social networks is what we are using. We have gone through them, their Instagrams, also their Facebook pages, and I send everything through them to put out for all of Newberry County recruitment. That's for our junior program, our Explorer programs, which I'll get into in just a second, but also our volunteer programs, and as well as our Career Center program. If you're not familiar, we do have a Career Center high school program, Firefighter 1 and Firefighter 2. We're certifying our junior firefighters in high school, at the high school, during school hours through the Career Center program. That's a conjunction of Department of Education in South Carolina, the South Carolina Fire Academy, as well as us here, the local department, the city, and the county of Newberry. The program has been a success, and we're continuing to recruit that program, and we're seeing those numbers rise until this year, obviously with COVID. Educational ads through Newberry Magazine and Electrical Cooperative Southern Living Magazine. That's most recent. Newberry Magazine stepped up and let us put an article in there, and so did the Electric Co-op. And those are ways that we can actually get the word out at a low to no cost to Newberry County or Newberry City. And that has already been a success. That's only been a few weeks, and we've already gotten a couple calls from those outlets. Radio advertisement through WKDK, Jimmy Coggins, and the radio network over there has been real good to us since we started recruiting. They're letting us do our advertising through them as a kind of a public service announcement for the need of volunteer firefighters. We're also doing, and you'll see it in a little bit, we're doing some coffee hours with those folks, and we're really looking at diversity, and that's been a big thing that we're trying to accomplish here in Newberry County, is making sure when we step off the trucks that we look like our community. As you know, the fire service hasn't been very good at that over the years as a whole, and that's nationwide. But we've been doing Black History Month, getting on there and actually highlighting some of our black firefighters, as well as talking about the history of African Americans in the fire service. So that's been something that they've helped us with. Also Women's History Month, as well as Hispanic Heritage Month. We're looking at getting on those coffee hours during those times. We put banners out at all county recycle centers. I figured this is a place everybody has to go, so we might as well put something there. And it's actually been a benefit. I think it was just probably a month ago, I moved one from one location down to Little Mountain, and I had a call within 2 weeks of putting that banner up at the recycle center. So we are looking at ways that we can do things at a low to no cost to the county as much as we can. The 2021-2022, what I'm looking at now is I have presented a budget to the city and the county for Tommy and Chief Minnick to go over with their administration to see if we can fund and split some money there. The budget material we're looking at more banners, more yard signs, rack cards, and that's just a front and back card that spits out a lot of information. The new generation, they're not looking at pamphlets anymore. They're going more to the rack cards because it's easy, it's right in front of them. And other just general paper material. Budgeting advertising for high school programs, that's to target our juniors. We're actually in the programs at Whitmire, Mid-Carolina, and Newberry, and I want to hit the academies and the private schools as well. Those football programs are targeting these junior members and these career center recruits. Social media through Newberry City social media outlets. My plan for that grant was actually to have a social media analyst who would handle all that for me, and they also would collect data. That was part of that grant and a big part of it, so we could actually look at the analytics on the other side as we went through those 4 years through that grant. Presentations at job fairs, career days, and other organizational gatherings. I think on the last slide I didn't hit on it. 2020 really shut down some of these events that we were going out and recruiting at, and so we had to find some other ways to do that. But that is a huge benefit to go to the schools on career days to get our young folks involved. We got to hit them young. We got to get them young. We got to get them involved before they get into other groups and before they get to the workforce when they don't have time to volunteer and get those training hours, which I'll talk about in just a second. The radio coffee hour I've already hit on, and then the each one reach one, that's something been a statewide push, is that each person reach one person. And I challenge every department, I challenge our department too, is that I'm a recruiting coordinator. I don't have to be the only recruiter. We need to go out and really find the faces of our community that we want in there. And that's been a push for Newberry County, saying that some departments don't need just firefighters. They may need administration workers. They may need support roles. And I know Chapels is one that was taking on that role. And it's been, Mrs. Scurry, it's been a real proud moment in my recruiting is that we've gotten Chapels rolling trucks again. They work direct for about 4 hours a day. And every time I hear those trucks roll up there, it puts a smile on my face because they were ready to close the doors at some point. So we got to keep looking out for those guys that may not need firefighters. They may need that person to direct traffic for 2 to 3 hours. And how do we continue to increase retention and recruitment? As you know, everybody's having a hard time recruiting as these other agencies talked about, and they're raising, they're getting raises to do this, and we're still obviously looking for people to do this at little to no pay. And what we're looking at is increased stipends, and again, these are just some ideas. I appreciate the stipend that Newberry County approved for our volunteers in Newberry County. That has really helped, and I appreciate that very much, and so do they. But even offering a STEP program for volunteers who meet additional participation standards, who are going above and beyond, may be an incentive not only to recruit, but also to gain more participation from those volunteers. Property tax discounts obviously has been something that's been thrown out there, and obviously is not something that's a popular subject at all times, but I always say, people say, well, how can we get more involved? I think we have to give volunteers something that they really don't want to lose. And not only that, but their families don't want to lose, because their families are having to spend a lot of time at home without their loved ones, and their loved ones leaving the house during birthday parties or other engagements that they're missing out on. Scholarship opportunities, this is something we had in a previous grant that I thought worked really well. And that's not just for junior and Explorer members, for actually operational active members who meet those participation standards. And obviously there would have to be a review board to grant these scholarships. But also for family members. I think that would be something that would say, hey, I want to stay engaged. I got a couple kids going to college. Maybe I want them to have that opportunity to get a scholarship. And again, I think in the Explorer program, we really saw some good benefits to that over the 4 years that we had that program. 2020 recruit training, again, I think training our volunteer, it's one thing to recruit them. If we don't take care of them when we get them in the door, mentor them and train them, we're going to lose them. And that's why we started developing these training programs in Newberry County. 1152 basic firefighter in 2020, we did finish that program before COVID shut the fire academy down. And that was 113 hours that we finished toward the end of February, 1st of March. We had 12 Newberry County firefighters in that program. And we're offering this class every year. We're offering the basic class every year for new recruits. We were going to do more training, and we got shut down. Chief hit on emergency vehicle driver training, that 40-hour course. We were able to put that on with Newberry County firefighters, and as well as Pump Operations 1, which is an additional 40 hours. And all this is done right here in Newberry County. The 2021 training schedule, and we hope to get through this year. The 1152 basic firefighter, again, has began last weekend, and it'll roll through February. We have 11 Newberry County members in that course this year. Hazmat Operations will be coming up in March, and then in April we'll have a firefighter 1, which is 43 hours, and then we're going to offer a basic auto extrication, followed by a firefighter level 2, which is 52 hours. These are all in conjunction. This is a full recruit program to the highest level. This is the same thing they offer at the fire academy in an 8-week program. We offer this on weekends and nights. That way the volunteers can meet those. Volunteers that work a day schedule can meet these hours. And then we're going to offer a technical rescue, and this was a request class, which is 16 hours, which is basic rope rescue, and then a 3390 confined space operations and a 3392 confined space entry. That's over 300 hours of training that we're offering, and this is either IFSAC national accredited training, or it is a South Carolina Fire Academy training. Newberry County Career Center, it got shut down. Obviously, as you know, the schools shut down, I think, around March 2020, and our kids got sent home. We had 8 kids in the Firefighter 1 program at that time, all on track to finish. I was shocked to come back in the summertime and notice that only 3 of those actually finished what they were supposed to do. But I was also very excited for those 3 that actually committed themselves to do that. Those 3 students came back and tested. They've already challenged and passed the national certification exam for Firefighter 1, and they have also graduated and completed the Firefighter 2 program this year. We have them currently registered to take their written exam. They've already passed their skill exam for Firefighter 2 this year. They're all joining. This is what I'm most proud of. Every one of them, we have a very successful program. When I look across the state and I talk to other agencies, a lot of agencies have 15 to 20 kids in their class, but they have 0 certifications, some of them coming out. We care about quality and not quantity in recruitment and retention, as well as training. And we've got 3 great young people coming out, one's going to Newberry City, one to Prosperity, and one to Fairview. And we're very proud of that we're actually placing them as volunteers in our county. Continuing here to 2020, 2021, the CTC Firefighter 1 program, I think, I'm not sure, I've heard 30% of the school basically went virtual at some point, and most of those, as you can imagine, were high school students. And this has affected every program at Newberry County Career Center. There are some classes who have gotten no enrollment because of the COVID-19. And we're going February 1st. School is set to meet back, hopefully 4 days a week. And if that does, some of this may change. But right now, we only have, it says 2. I actually have 3 students enrolled in that class. And amazingly, they're all female, which is great. So there's some diversity for you there. So this will be our first all-female class coming up starting next week. First EMT class is rolled out. It's something we've been working on for, I guess, 4 or 5 years, trying to get an EMT and actually a fire science certificate through Piedmont Tech. We rolled out the first EMT course this year. The two of the firefighter 2 students will be going through that class, and they'll get a completer certificate from Piedmont Tech if they complete. And then, you know, we're working on a recruitment for the CTC as well, and I had the video there, and I'm not sure if I'll be able to play it. I'm sorry. I thought I had a mouse so I could actually play that video, but we can shoot. I do have a helper. Thank you. And this is just a pilot. This has not been released quite yet. I guess it's being released now, isn't it? Will you be able to get through that or no? Okay. We'll just back out of that. That's okay. It's a recruitment video that we'll be rolling out real soon, and we're working very closely with the new director, Miss Sarah Harvey. She's actually come out to the training grounds and done some training with us. So with that, Newberry City Junior Program, also Fairview has an Explorer program. We're age 14 to 18. We have 11 active members. That grows through the year to about 20 to 25 adding members. By the end of the year, we actually take people off who have turned 18 and hopefully put them in a volunteer department, or they haven't met the participation standard that we set forth for them, and so we take them off their roster. We have 2 females, 1 black male, and 1 Hispanic male. This program is where we really want to see our diversity at, because the young people coming together from the schools. So we're hoping that this also will change some of the diversity issues we've had. Any questions?
Any questions from anybody on the committee?
Just want to personally thank y'all for working with Chapels.
Yes, sir.
Did a fantastic job there,
Yes, sir.
and please hang in there with them.
Yes, sir. We are. We're very proud of them as well. Yes, sir.
Thank you very much.
Thank you.
The same thing happened, I think you mentioned it, with the other programs out at the Career Center. They didn't get followed up and finished, you know, when they went virtual. They just a lot of them kind of dropped out.
Yes, ma'am, they did. It was very tough on them because most of these classes require hands-on and in-person training, so it was a devastating blow for all programs.
All programs.
Yes, ma'am.
That happened, so.
Yes, ma'am.
I don't know, I wish they could go back and pick those, like that last quarter up and to help these.
Yeah, because they put a lot of hard work in. Yes, ma'am.
A lot of them didn't go take their state test or whatever, they just, it was like over.
Let it go. All that work. Yes, ma'am.
I thank you for your efforts. It is a national epidemic, I'm afraid.
It is.
I don't go anywhere in the nation, I don't hear this, and so, and I don't think most people wrap their head around, not only you're asking that person to get up in the middle of the night and go fight a fire, but you're asking them to give a night or 2 every week to some form of training and some form of continuing education. And so it's not just, will you go fight a fire, it's will you give us a couple of nights a week from your family to continue to keep this up so you can even go out and do that, not counting cleaning equipment and pump tests and there. So it's, I don't think most people have any comprehension of what we ask of our volunteers and how blessed we are to have what we have.
Well said.
Thank you for your service.
Thank you.
All right, Tommy, are you done now? Okay. All right, public comments from anyone signed up? No. Okay. Executive session. I don't believe we have one of those called for, so is there a motion to adjourn? Motion in the second, all in favor by show of hands. It is unanimous. You are adjourned. Thank you.